Hello students, I hope you have gone through the last part of this chapter, reproductive health, problems and strategies. So after that, today we'll start with methods of contraception. Now what are contraceptive methods? Methods of contraception or contraceptive methods are methods that will use to prevent pregnancy, to prevent the happening of pregnancy. Okay, and the devices that are used, they are known as contraceptives. So when we say contraception, contraception is done to prevent pregnancy. And the contraceptives, the devices that are used to prevent pregnancy, they are known as contraceptives. These are the devices used to prevent pregnancy. So there, an ideal contraceptive. What is an ideal contraceptive? An ideal contraceptive will have certain characters. When is a contraceptive said to be ideal? So first, they should be easily available. They should be available everywhere, easily available. They should be effective. Means they should work, give 100%. Then it should be reversible. And most important, it should not have any side effect, or it should have less side effect. No or less side effects. Okay. Now, there are various methods of contraception. So first we'll see natural method, where no devices are used. It's just natural. According to natural ovulation cycle or menstrual cycle, the pregnancy will be avoided. That is natural method. Then we'll have barrier method, where physical devices are used or barriers are used. And then we'll have chemical method, where some tablets are used. Then we have IUDs, intrauterine devices, which are implanted in the uterus. These are also devices. Then again we have surgical method also, that we'll see later. So first we'll start with natural methods of contraception. Natural methods. First is, I will write A. So we all know, we have seen in the menstrual cycle that in the 14-day ovulation occurs. Means the egg is released. So when this copulation is avoided in the 14-day, means in the 14 to 17 days, suppose in the 2 or 3 days the egg will be there. After that the egg will change to the egg will be degenerated, or menstruation will occur. So and during those ovulation days, when egg will be there, if copulation is avoided, then there will be no ovulation, means there will be no fertilization. The sperm and egg cannot meet. So during those 14 to 17 days, if the copulation is avoided, then there will be no fertilization, or then pregnancy will be avoided. So first will be by avoiding to 17 days of menstrual cycle. Because after this, egg is also lost, so there will be no fertilization. The next will be avoid or abstain from deposition of sperms in the vagina. Means here, even if copulation is done, then before the sperms are deposited into the vagina, the penis should be taken out. So then this pregnancy can be avoided. So this is again a natural method. The next is, we know during lactation period, when the mother is breastfeeding the baby, there will be no menstruation. So again during that there is no ovulation. So since there is no ovulation, no egg, there will be no fertilization. So again, if during lactation copulation is done, pregnancy can be avoided. So that is known as lactational amenorrhea. Means during lactation no menstrual cycle, so no ovulation occurs. So since no ovulation, no egg, no fertilization. So these are the natural methods. Next we'll see barrier methods. Barrier methods are physical devices which are used, and this is most common. These are used for both males and females. So first will be, which is very commonly used, condoms. Condoms are physical devices or physical devices only, physical contraceptive devices which are available for both males and females. Okay, so using condom is a barrier method because it provides as a barrier so that the sperm cannot reach the egg. They prevent the meeting of both sperm and egg. So it is a barrier method. Next is cervical caps or diaphragm. Again, this is a barrier method for females. Condoms are used for both. They are available for both male and female. Cervical caps and diaphragm are available for females and they act as a physical barrier. So these are barrier methods. They do not allow the sperm and egg to come in contact. Okay. One very important thing, these barrier methods are most common and they help to prevent sexually transmitted diseases. They prevent STDs. Okay. So after barrier methods, we have intrauterine devices, IUDs. Intrauterine devices or IUDs. Again, these are only for females. These are certain devices which are implanted in the uterus. Okay. These are done with the help of a physician or a doctor. And these are very common also nowadays, IUDs. So first is non-medicated IUD. Now non-medicated IUD is implanted in uterus and they do not contain any medicine. Example is Lipper loop. Lipper loop is an example of non-medicated IUD. So these are certain devices like this, having the structure of a T like this, and these are implanted in the uterus. So this is the first type. Next is copper releasing IUD. Copper releasing IUD, as the name suggests, these will release copper ions. Now what will copper ions do? Copper ions will reduce sperm motility and increase sperm mortality. Means these copper ions will not allow the sperms to move. They will reduce sperm motility and kill the sperms also. So increase sperm mortality. So example, copper T, copper 7, and one more is multi-load 375. So these will release copper ions, and these copper ions are important because these copper ions will reduce the sperm motility and increase sperm mortality. Okay. Next is hormone releasing IUD. Hormone releasing IUD, as the name suggests, these will release hormones, and these hormones make the uterus unfit for implantation. The uterus will become such that the fetus cannot be implanted in it. So ultimately this is a contraceptive device. Example will be LNG20. One more is progestin. Okay. So non-medicated IUD, this is also implanted in uterus. This is a contraceptive device. Copper releasing IUD, a contraceptive device which will release copper ions, which will reduce the sperm motility, increase sperm mortality. So again, pregnancy is prevented. Hormone releasing IUD, this will release hormone and make the uterus unfit for implantation of the fetus. Then next we'll see some chemical methods. Before that, just remember, these IUDs increase phagocytosis. That means sperms would be engulfed by phagocytes in the female tract. Okay. So in case of IUDs, phagocytosis occur. Means the sperms are killed by phagocytes. Where? In the female reproductive tract. In the female reproductive tract. So this is the main motto of these IUDs. Mainly they kill the sperms. Okay. So this is done. We have seen three methods: natural, barrier, IUDs. So next we'll see a method. It is a chemical method. Chemical method means here hormone pills are used. You have heard about hormonal pills. Hormonal pills which are taken orally and pregnancy is prevented. Okay. So these hormonal pills it can be purchased from any medical store. Like examples are Maladi, and then Saheli. Now you have to remember one thing. Saheli is a non-steroidal. The rest are steroidal. So Saheli is a non-steroidal hormonal pill, which is developed by the CDRI, Central Drug Research Institute, Lucknow. CDRI, Lucknow. Okay. So again, under chemical method, you just have to know about the hormonal pills. And Saheli is important because question comes on this, because this is a non-steroidal hormonal pill, unlike the others, which is developed by the Central Drug and Research Institute, Lucknow. So after this, next we'll see the last method, which is the surgical method. Number 5 is the surgical method. And surgical method is available for both males and females. So in case of males, the vas deferens is cut or ligated. Okay, then the sperms cannot pass, and so pregnancy can be prevented. And then in case of females, the fallopian tube is cut or ligated so that the ovary cannot pass. Okay. So in case of, this is for both males and females. In case of males, cut or ligate vas deferens. Now why we say ligate? Because it is just tight, so that if the person later they want to make the vas deferens normal, they do not want to prevent pregnancy, then again that can be reversed. So that surgical method or operation is reversible. So that is why it is just tied. In case of males, vas deferens is tied, and in case of females, cut or ligate fallopian tube. So again, in this case also it is reversible. It can be made normal again. Okay, so this surgical method, in case of males, since vas deferens is cut, it is known as vasectomy. Vasectomy. And in case of females, since the fallopian tube is cut, it is known as tubectomy. Okay. In case of males, it is vasectomy. In case of females, it is tubectomy. So in methods of contraception, you have to know about all these different methods. So next we'll start with another